Welcome to another episode of Behind the Business presented by Gore Mutual. I'm your host, Ian McLean, President and CEO of the Greater Kitchener-Waterloo Chamber of Commerce. This podcast is recorded on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. Each week I sit down for candid conversations where we go beyond the boardroom and behind the business to uncover the real stories of Waterloo Region's business community. Today, I'm joined by Dr. Mohamed Alarakhia, the CEO, founder, and visionary force behind Amplify Care. Amplify Care is a not-for-profit founded as the eHealth Center of Excellence in 2014 and was established to support clinicians and their teams with innovative solutions that meet their needs and improve patient experience. Dr. Alarakhia's career spans family medicine, digital health, and education with deep roots in Waterloo Region. He's a faculty lead at McMaster University's DeGroote School of Medicine and a practicing family physician at the Center for Family Medicine. In this episode, we're unpacking what healthcare often gets right about technology adoption, how AI and automation can build trust and confidence in clinical settings, and why the input from both patients and clinicians is critical to meaningful innovation. We'll also talk about leadership, navigating a career that bridges medicine and technology, and what makes teaching the next generation of clinicians in Waterloo Region so unique. So join me in this episode as we go behind the business with Dr. Mo Alarakhia. Well, thank you so much for making time for us, Mo. It's been, I know you are so busy and you're traveling and doing so much great work. We appreciate you taking some time to talk with us today.
Yeah, it's really my pleasure. And the Chamber is doing tremendous work as well. So happy to be here.
Well, that's mostly Jenna, but we'll take credit where credit is due. So now, we've known you for years, and I've been at the Chamber, I think, 16 years, but dating back to 2014 or 13 was the first time we met. And it was around the family physician recruitment weekend. But walk us through the background of your connection in both academia and healthcare, because it's in your connection to Waterloo Region, it's been extensive and really important for the region.
I think the important thing is I grew up here. So I started here when I was 3. My parents immigrated here when I was 3 and grew up in this region, fantastic region. And then had to go away for school. So went away for university, medical school, and then came back to this area. They have a great family medicine residency program. Mm-hmm. So I actually went through the local program, well-known program, really allows you to practice in the community, which was really important to me, and then stayed around. So I joined the teaching team and I've been teaching since, and I'm the faculty lead at McMaster for digital health and innovation in the community. So support our residents and our medical students with understanding where technology can help their practice. The other reason is this is a great place for family. And I've seen it tremendously grow over the last 40 plus years. And, it's a great place to have a family, lots of different activities to keep them busy, and great institutions for them to go to school.
So, I mean, let's talk about for me, and it's newer for me because I know you are the Center for eHealth program is what I remember, but it's now Amplify Care. So talk about Amplify Care, but also the sort of what led to that.
Yeah. So, we really started by looking at understanding the problems in the healthcare system. And one of the problems was physicians are burning out and they really don't have the capacity to serve more patients because of that administrative burden. So we really looked at that's a big problem that we need to solve. And so we went out to look at how do we solve that? And that involves working with government and looking at different programs out there and how do we make sure that the clinician perspective is there and how can they serve patients better? It's all about serving patients better. And if a doctor's doing paperwork, then they're not really serving patients. And so we went and looked at different initiatives that we could undertake to support patient access to specialists, as an example, right? Wait times are long. Sometimes I send 5 referrals before I get a patient in. That's a lot of unnecessary work for myself. So we started tackling that problem and looking at technology. And we were very fortunate. There was 2 brothers out of Cambridge that developed a technology to solve that problem. And we supported the province with getting that technology. And now it's scaled across 3 provinces, really. And it solves a really critical problem in terms of wait time. So we evolved from what was known as the eHealth Center of Excellence to Amplify Care as we've actually spread our footprint across the country now. So we are now in 6 provinces, really helping to digitally enable care in better and more efficient ways.
So you're a practicing family doc. You have your own patients.
I do.
You are connected with with Amplify Care, but on the academic side, or sort of the development of new ways of using technology for actual doctors who are business owners. By the way, you got to run the business, you got to do the administrative part in healthcare. You built and so your career has been built on that intersection of clinical care, so being with patients, this innovation that you just talked about. What was it that inspired you to rethink how primary care? Was it almost a defense of like, I don't want to practice the way that they're forcing us to, and to try and get to something new in the province of Ontario?
It was sort of the spirit of this region as well. Like, we can do things differently. We can make care better for patients. You saw patients struggling to get in, and get access to primary care. I saw patients who were managing diabetes, and it was a challenging thing. So one of the first projects we did was a patient portal for diabetes, where patients could enter their information and their physician could actually look and sort of track them in an appropriate way that didn't create burden. And so it just allowed that relationship between physician and patient to be better. So, there really was a spirit of, hey, we've been doing the same thing for decades. How do we actually do it in a more efficient way so that it's better for the patient and it's better for the clinician in terms of reducing burden? And I think, the spirit of this region is to maybe try some things out that others wouldn't. And it was about doing that and then being very successful at it.
To talk about, the eHealth Center of Excellence, and it has become Amplify Care. Just talk about how that transition happened.
Sure. So we're a not-for-profit organization. We're funded by government to get tools into the hands of clinicians. We work with government to procure technology companies into the healthcare space, which historically has been a challenging thing. So we have a whole session on that. We are still mission led. We are the leading digital health partner for primary care and integrated care. We support community clinicians with getting technology. The mission is the same of the organization. We're a not-for-profit organization, but really, as technology has evolved, our job is to amplify the voices of clinicians and patients. Right? That's been a missing piece. When technology comes down, you don't get doctors and nurse practitioners and others really contributing to how it works, and therefore they don't use it very well, right? And it actually adds burden. It's one of the bigger causes of burden, electronic medical records. And for patients, really, their voices are lost as they're waiting in sort of a black box of not understanding when their specialist appointment is, or getting the information that they need to understand what's happening with their care. And so our job is to amplify those voices and really make sure the technology that we're implementing supports care and doesn't take away from care.
And some of this actually translates on both sides. So you just talked about the patient kind of saying, "Hey, when's my appointment?" And of course, there's worry the minute that you have an appointment and say, "Oh, geez, you've got either something like diabetes developing," and how to manage that, to more other issues that maybe involve cancer or other things where there's more of an emergent, diagnostics or treatments that are required. But it's also for the doctor too, the family physician, of saying, like, how do you keep on top of saying, I've made the referral? You can be managing and trying to expedite things for your patient. So it is on both sides. It is a help to the physician, but it's also got the, as you say, the end user, the amplifying the voice for the patient as well.
Yeah, just imagine like you've got a particular diagnosis and you need to see a specialist, right? And right now it's a black box. Unfortunately, it's a fax fest back and forth. We still use fax machines.
That's unbelievable. That's just shocking.
So we've got to get rid of those. And there's some good work that is progressing to get rid of those. But so right now it's the patient's been referred and it's a black box. And the patient worries, like, what's going on? Have I actually been referred? Did someone pick up that piece of paper on the fax machine? And as a physician, I'm responsible to look after the care for the patient. And not only do I want to have that referral accepted, I want to make the right referral to the right person, and I want to do it in the shortest wait time, right? And there's great technology that does that. Like, we do it in other industries where we're routing things to the right place. Why not leverage that in healthcare? So now we've been successful in implementing a system where patients have full transparency. The patient knows the patient's been referred. The patient knows I've been triaged. Patient gets an appointment online and confirms the appointment online. We've had like 150,000 patients comment on this, and they love it. And it's served. We've done over 4.4 million referrals in this province alone.
And you reference faxes. There's still some real antiquated parts of the healthcare system, but ultimately it's still, to a large degree, the gateway to healthcare is primary care.
Yeah.
Either a family doctor, maybe a nurse case practitioner, there could be some others, but by and large, that's how you get referred to the people you need to see for whatever your issue is. But it's rapidly changing. So you're helping to try and expedite and say, how do we leverage technology that already exists for both the doctor and the patient? But the whole healthcare environment is changing fast. New diagnostics, new treatments, you name it, it's happening, and that's a good thing. So talk about the supporting of physicians both in the clinical part, the navigating the business part, because that's the other part is like time where you are on the administrative side of whether it's referrals or following up on those things, using technology to do administration, the business side because you're a business owner, and the patient side.
Yeah, let me tell you, we don't learn much things about business when you're in medical school, right? So that is a challenge, right? But you're absolutely right. You are a business owner. You need to do all the human resource work. You need to make sure you manage sort of that office and get that office sort of running. And so we help with that. And there's a lot of different tools that clinicians can have to really say, like, how is my office running? And then how do I actually support my staff? And that's the other thing that staff are also burning out, right? So the Ontario government data says that, reception staff or medical office assistants are burning out, and we'll have 3,000 fewer than we actually need in the next 4 years. So we have a human resource crisis. And so how do we help those people? And so there is like an AI. So this is where the intersection, there's an AI assistant for reception staff that actually helps answer the phone, right? So the reception staff can deal with the people in the office, can help the team. It can answer the 20 calls at once. It speaks in whatever language you want. Wow. And so the patient can speak in their native language.
And in this community with so many, we're a very diverse community now. Yeah. You get lots of that.
Yeah, and so it can communicate with the patient, can provide information, and actually can book the patient into the schedule automatically, right? And so now this is support for the staff in the front desk who can actually see the people who are coming in, who can help manage more complex patients, help them navigate in the system. And so that's a way that you can help the back office a little bit with the administrative support. And then on the clinical support, you imagine like all the new treatments and things that we have now, you can support the physician or nurse practitioner with advice and give them like, here's what the next treatment should be. And so you're really looking there at cutting edge in terms of providing suggestions. It's always going to be the physicians or nurse practitioners.
Ultimately makes the decision.
Exactly, decision. But you're surfacing things that might be important, right? And as we look at more personalized medicine, which is where things are going, what is important for you as an individual, based on your family history, based on where things are with you, based on what's already happened, what is the next step for you? And so I'm really excited about that because it does lead to more tailored care for the person.
Now, Amplify Care is associated and with team-based care and data-driven primary care, which has not always been the case. And a way to describe that for someone that's listening is, 20 years ago, it was Mo and two of his friends had a 3-person office, and you might have 2,000 patients apiece. But that was it. That was your practice, and you had to negotiate when you were going on holiday and if someone was going on paternity leave or maternity leave. But that's not the way the new doctors are being trained in university. They're sort of trained in teams and in larger groups where they have. So talk about modern primary care, because that's an issue for us in terms of the work that Jenna does to bring family physicians here, and they're talking about a healthcare crisis in assistant or medical technicians or assistants. It's there in family doctors. We're helping with that. But people are expecting to practice when they're finished their school in the way that they were taught. And we've got that transition. So how does it, talk about how the team-based care is different than the way it used to be, because we're kind of in the middle. Well, maybe not in the middle, but we're certainly not all the way through that transition.
Yeah, 100%. So about 20% of clinicians in our community practice in teams, right? So it's
a long way to go.
We have a long way to go, but we are getting there. This is the government funding, the $2.1 billion of government funding looking to form teams. And you're absolutely right. Like the students that we train in teams.
Yeah.
And and we know that's a better way to practice because it gives you that flexibility if you need to sort of take some time off. It also gives you the expertise of other individuals. I'm very fortunate to be part of a team. I work with a pharmacist, I work with nurse practitioners, I work with social workers. They have expertise that I don't have, and they complement the work that I do. And we work as a team around patients so that we can support patients who have mental health and addiction issues. If there's an issue with medication and challenges medication, the pharmacist can look at that and make suggestions. And so it really is a better way to be to manage complex patients, but also do proactive care. We can look at the medications in advance and say, well, no, you don't need to be on these medications. And so I've stopped a number of medications for patients who actually, it wasn't actually doing any benefit, and there could be some side effects. And so it really allows patients to have that more holistic care. It also improves access. They may not need to see me as their physician every time. They see another provider, and that provider will keep me in the loop. That's the other thing, is that we all communicate together. There's one record, so I know what's happened when they've seen the pharmacist or the social worker, and I can just carry on the care there. So, team-based care is the way that of where we need to go. We know, from the evidence that it improves access to care, and it improves, decreases like emergency department visits and hospitalizations, and we have a big problem with that. So it's really great that we are moving forward and doing that in the province. And then you look at what are the enablers for the team? How do you support communication on the team? How do you support planning around the patient so that everyone understands what's the goal for the patients, what the care plan is? So those are some of the enablers that we work on.
The Behind the Business podcast is made possible through the support of our title sponsor, Gore Mutual. Proudly Canadian, Gore Mutual has stayed true to one purpose for more than 185 years: insurance that does good. It's the reason they exist. They believe that when we focus on being good, doing good, and spreading good, we all thrive together. We're grateful for their continued commitment to our local communities and the positive impact they make every day. For more information, visit goremutual.ca. Waterloo Region rightfully has this, and you referenced this off the top, has a strong reputation as a global tech hub. Like med tech is a growing part of our region. How has being part of that ecosystem locally, how has that influenced the Amplify Care's work in digital health, AI, new medical products, new approaches to healthcare? I mean, does it make a difference to be here versus somewhere else?
I meet up with startups and scale-ups all the time, and it really informs us of what's possible, right? We have these complex problems, and everyone calls them wicked problems in healthcare. But we have really smart people solving wicked problems every day in our community, right? And so really is about that problem-solving ability, that entrepreneurship to really try something out. And so it's really given us a good environment to unpack problems, to meet with smart people who have the solutions to these problems that we previously thought they're too complex and we're not going to get there. We know that some things are incremental in healthcare, but there are some ways that we can transform the system. And it's really allowed us to be in an environment where we're testing and trying things out. And especially with artificial intelligence, there's a lot of potential, but you've got to try these things out. You got to make sure there's the right safeguards with it, that it is, you're using patient data. You've got to make sure that is sort of well protected. So we're able to put those guardrails around it while trying out these innovative things. And then, once they get evaluated and if they're successful, then we're able to scale and spread it. So this community has allowed us to have those conversations with people who are doing those things, and then really pitch what a future practice should look like. How should we leverage this technology and think in different ways?
And this doesn't just benefit us here. Obviously, we have our own needs here, but this is something that presumably, a lot of times our friend Tony Lamantia at the Waterloo Economic Development Corporation says, hey, we're inventing the future right here in Waterloo Region across, whether it's advanced manufacturing, whether it's med tech, devices, AI, take your pick. And this is another one where we hope to be able to take the work that you're doing, Amplify Care, and make that available across the province, which is why the province is pretty excited about what you folks are doing,
and across the country.
Yeah,
and I think, we know the problems are common that we've seen sort of across the country, and if we can develop and test the solutions here, then people know they work, and then we make sure that we customize them to some of the local sort of differences that are there. But you're absolutely right. We can test things here, we can demonstrate that it works, and then we can scale and spread across the country.
And that makes it more plug and play for other communities, that they know the pieces that have to be in place to make it work for them in Windsor or Winnipeg or right across the country.
Yeah, that's right. And we also learn from them. I think This is where there's it's an ecosystem where we're learning from other people and we're able to implement here. I think we have a lot of good momentum and a lot of willing people to participate. The other thing is that we have a great group of clinicians, physicians that are willing to participate. Over 700.
Wow.
Sort of, that as a pool that we can actually leverage to try and test things out. And part of this is the work through McAccelerate and the McMaster Medical School that's really supported their faculty to be involved in innovation. It's actually one of the pillars in terms of supporting med tech companies to test these products out, because it's hard. It's hard for these companies to get into the healthcare system. So if we can facilitate that, test it out in a safe way, prove things that work, and when they work, we can start to then export them.
One of the challenges, and we work in this day, or Jenna does, day in and day out through the chamber, the work we do on behalf of the community. It's not business or chamber work, it's the community's work on family physician recruitment, but broadly, it's primary care. We know that there's access to primary care is a problem. Patient attachment, so and it's all driven by growing population, aging. Not that you're a young guy, but there's lots of older doctors that are coming up to retirement. And when an older doctor, and this is something that I think still holds true, is when an older or someone that's going to retirement age as a family physician may have a patient load of 1,800 or 2,000. New doctors coming in won't take a patient load of that. And that's why they want to be in bigger groups in that group setting. So we've got patient attachment, we've got primary care, we've got growth, we've got more and more women in that are in family physician and medical, and they have their own families, so they're in and out of the workforce. All of those things add up to challenges of making sure that everyone has access to primary care of some sort, because we've already said it's the gateway. Where do you see the biggest opportunities to improve access for patients to have that primary care? And, is there something, we're doing our part, but are business and community partners, what's the role that we can play to make sure that we're trying to get on top of this issue that affects all of our fellow citizens? Yeah,
I think you're right. So it's about attachment, so being attached, but it's also about access. So if you're attached to a family doctor but can't get in for 3 weeks, that's not good access. So we want to make sure we facilitate, both attachment and access. The Canadian Medical Association and the Canadian Federation of Independent Business just released a survey last week saying there's 20 million hours of unnecessary paperwork, right? And that's draining clinicians. And so the clinician who, could take, 100 more, 200 more, 300 more patients doesn't because of that administrative burden. So what I feel the community can do is if we support like these innovative clinics that where they have cutting edge technology, where we're reducing the administrative burden, where you've got some of the back office stuff taken care of, then clinicians are walking in and being clinicians. They're seeing patients, they're supporting care. There's some great technology, AI scribe technology that will help you do your notes for you. And so we know that decreases 3 hours a week for a clinician. So that's time that you could serve other patients. So I feel like if we can rally around, we want to create this future model of primary care. We want to support these clinics which run efficiently, which decrease administrative burden, that serve patients in a better way. I think we'd recruit more people. And I think also then we would be able to try the technology. These technology companies would have evidence of their things working, and then they would create jobs, and then we could export it to other places. So I feel like if we can rally around this concept of like an innovation clinics in this area, then that would be really great to recruit physicians and keep them around.
You've worked closely, and we've touched on this a little bit, but I want to drill down a little bit. You've worked closely with startups and emerging health technologies locally and more beyond Waterloo Region. What digital health trends or innovations are you most excited about that aren't yet available, but are the things that you say as we get to that new format of primary care? But there must be some. I mean, it's happening fast. When you're talking about AI, that will adapt. What are some of the other kind of really exciting health trends or innovations that you think are really going to move the needle?
Yeah. So there's agentic AI, which is a different type of AI where you have agents that actually take on human activities that are boring and mundane sort of tasks. These agents, I feel, will become part of the team. And so I feel like you will have team members that are AI agents that support your staff. I think there will be an AI assistant for physicians and nurse practitioners where that is supporting you with distance support and really also helping with the population management. So, I see one patient at a time and I sort of help that patient, but I'd love to have more time managing my practice and understanding which patients are at risk for something and looking at screening. And so there will be these assistants that do that. And then I'm excited about a personalized patient assistant where there's a coach that can support the patient through their conditions. And there was a recent journal article that looked at coaching for diabetes, and the AI coach was equivalent to a human coach. And so that means that the human coach can do more, see more patients, or supervise the AI in terms of looking after patients.
So just on that, so if you've developed diabetes and you have to manage, your blood sugars and whether you're on pills or insulin or whatever, and there's other parts, lifestyle issues. I mean, is that what you're saying? That agent say, hey, have you taken your pill today? Have you, have you taken your 20-minute walk today? Is it those sorts of things that it's not an actual human being, but someone is remotely encouraging the patient to take their own steps on the healthcare journey?
Yeah, it's like an app on your phone that actually understands, this is where you could get your exercise in. And it can give you suggestions. Hey, did you know that you have a meeting here and a meeting here, and you could get your exercise in at that time? Or, you could take a picture of your food and it would say, this is what, you could track that over the day and say, and it could then suggest other options for you. Like, you might want to adjust the amount of vegetables that you eat, and then it give you suggestions on this is how you could actually do that, right? So very practical, right? We know people live their lives, people are busy, but so what are the practical suggestions in terms of diet, exercise, medication management, stress management? There's a different things there, and then imagine there's a summary of that could go to the physician before you see the physician. So then you could actually already know what's going on, and then talk about the areas where there need to be some changes.
Fascinating, and I mean we in anything, whether it's in business and manufacturing, if we're not getting more productive and not leveraging technology, we're falling behind. So, okay, looking forward or looking ahead. What's the long-term vision for the new Amplify Care? I mean, you talked, I think, a little bit about this, but Amplify Care and the evolution of primary care in Waterloo Region. What does success look like, or what does the future look like for Amplify Care in that context?
Yeah, I think first, from a patient perspective, we need every patient attached. We have tens of thousands of patients who are not attached to primary care, and we need those patients attached and with good access to primary care. And there's work that's happening. And I feel like we have the tools. We just have to put it together in terms of having that great patient experience about, I need to see a family doctor. I can call in, I can be seen, I can get that issue dealt with. So I feel like we can move forward with that for everyone. Amplify really is an accelerator to that. It allows you to have the tools, the technologies that are available to do that, to meet the sort of that patient where the patient is at, to support the clinician with practicing well with work-life balance. Our goal is to continue to be a key cog in this community, supporting all primary care clinicians, working with the hospital, working with home care to do that integrated care, because that's a big problem in terms of information flow across home care and acute care and mental health and addictions and primary care. So we want to support that. We think population health is a big piece. So how do we more proactively tell people about risks that they have and how to deal with them? And then, from an organization perspective, we're already working in 6 provinces. We want to continue to expand across Canada. In the fall, I was all over the place across the country. So, it was, I think the problems are similar. And, I think we have a great base here in Waterloo Region with which to expand across the country. And, I think we've seen that there is an opportunity to actually leverage the learnings that we have here and move them in other places. So we're going to continue to expand across the country, and then maybe to other countries. We'll see where that goes.
Well, you know what? It's the work that you're doing has always been amazing. I've always been impressed with it. But the intersection of new technology and data-driven ways to use technology for the betterment of patient care, it's got to be part of the solution so that we can keep more family doctors. Because it's not in fashion right now. People are ready to do other things, to do specialties or hospitalists, and we do need family physicians and nurse case practitioners of that primary care access. So keep up the great work, and you can call it whatever you like. Amplify Care, you can keep changing the name, just keep doing the work. Listen, it's been fascinating to get caught up with you and as community leaders and running in the healthcare front, but also how physicians run their own business is fantastic. But this podcast is always a little bit about the leaders, of which you're one, and how they kind of approach leadership in the broadest sense. So I always ask this same set of questions. So we'll do our rapid fire questions. If you could go back and tell yourself or your younger self something, what would it be?
Yeah. I think there'd be some investments I would have made when I was younger that would pay dividends now. But it really, I think it's about like a lot of the problems are multidisciplinary, and so when you're on a particular track, you're looking at sciences, you go down that track. But I would like encourage myself to experience other things, and I think that entrepreneurship, like there's some great entrepreneurship sort of experiences and programs that would have been very beneficial. Like I've gone through the School of Hard Knocks a little bit in terms of learning things, but it'd be great to get a little bit of more foundation in that.
Oh, that's interesting. What or who inspires you?
Yeah, I think, it really is the clinicians who are working hard and the patients who are, I think are doing great for themselves, but are really sort of struggling with the system. And so to me, it really is about that. It goes back to that. How do we serve patients in a better way? And because I see them, patients in my practice, they are really inspiring in terms of the things that they can do despite the system. So my job is to help them do things with support of the system.
If you weren't in your current career, hard to imagine you're not, but if you weren't in your career that you're in now, what do you think you'd be doing instead?
Yeah, that's a really interesting question. Like social services is something that I've always sort of been interested in, and population health. So like think of a public health sort of perspective, really supporting the population in a better way. Often we think about healthcare and you think about the medical stuff. It's actually the stuff outside of medicine that has the hugest impact. So to me, like social medicine and so those social determinants of health, so being either in education or research and that sort of thing, and how those things impact the direct health things. Exactly. Yeah. So public health research.
Yeah. Well, you'd be good at whatever you do, but that would be a good one. What are you reading? Like, what do you do when you do unwind, when you're flying to Winnipeg or Calgary, wherever you're going in your travels? What do you read, or a podcast? What do you listen to or read?
Yeah. So I've just started a book called Dual Transformation by Scott Anthony, and it's about really looking at how to build this business of the future while you're running your own business. So we run a business that's a not-for-profit. How do you build what should be coming? So it's really interesting about how do you set that up. Called?
Every business owner struggles with that, right? How do you reinvent your business while you're flying, or while we're trying to run it?
Yeah, so it's really great. It's about setting up team A and team B, and really looking at how do you sort of facilitate the people who are innovating and doing what's next. And I think with AI, I would encourage a lot of people to look at that because it is a different way of doing things, and we think about, okay, well, will it take the humanity out of things? But I think it actually can support the humans. I think it can actually make us more human. But it does force you to think about doing different tasks in different ways, and how do we work better with the technology. So yeah, I would encourage people to, again, I'm just getting through it, but I've heard really great things about it.
And if someone wants to connect with you or has a great idea that might make a difference in healthcare or in the community, how does someone find a Dr. Mo?
Yeah, if they go to amplifycare.com. Right, and just email us. They'll track me down.
All right. Listen, I know how busy you are. You're always generous with the chamber, and the program that we run, and on what you're doing for the community is amazing. So we appreciate you taking some of your valuable time to spend with us this afternoon.
My pleasure. Great to be here.
Thank you for joining us for another episode of Behind the Business, proudly presented by Gore Mutual, insurance that does good. New episodes drop every Thursday, so be sure to tune in next week. You can also visit greaterkwchamber.com to catch up on past episodes anytime. We'll see you next time as we continue to go behind the business.